Started. So this meeting is being recorded. I'm sorry I forgot to record last week's, but we will get this out to you. So first of all, I just want to start the call by saying that I know this has been an incredibly difficult week for schools. We are getting calls from schools and parents and everyone, and we know that you're really stressed and overwhelmed, and so we acknowledge that this has been a really difficult time. Our hope is that this surge is short, and we're hoping that by February we're starting to see a decrease in cases, which is just a couple of days away. Unfortunately, we don't think we're at the peak quite yet. We think we'll continue to see increases in cases for the next week or so. At least. So thank you all for all your incredibly hard work. We know that public health is a very small part of what you guys are doing every day. And so we thank you for your hard work on all of that. And so with that, I'm going to go ahead and get into our presentation for the day. So here is what we're going to cover today. We're going to go over a couple announcements and then an update on some Pima County data, pooled testing update, and then some testing training. Erica Spence, our trusty testing guru, is now back, thankfully. And so she is going to hop on in a few minutes and give us a bit of an update on testing. And then we also have some time for Q&A, of course. So the first announcement is that we've seen some letters that have gone out from schools to families, and we get calls about them. And the letters that we have seen they have Dr. Cullen's name on them, but they're not the letter that we have created and written. So if you have received any letter template from us that has Dr. Cullen's name, do not edit that letter. That was written and approved by Dr. Cullen. If we have a letter for you that is just a Word document that is not necessarily on our letterhead or doesn't have her signature on it, then that you're welcome.
She didn't even know.
Oh.
Okay. She's always like me. She notices the good things and kind of doesn't see the.
All right. Sorry about that. So if there's a letter that you are welcome to edit and send out however you'd like, we will make that clear. That will be in a Word document that's editable. That will not be in a PDF, and it won't have her signature on it. So please just keep that in mind as you're sending out communications to your families. And of course, if you want to create your own communications, you're more than welcome to do that. Just do not put Dr. Cullen's name on it unless it's something that we have written. The second announcement is that we have created some events recommendations. These are just recommendations for how to have a healthy event. It's kind of best practices. This is not requirements. It's just, like it says, just some recommendations. So this is community-wide. This is not specific to schools, but will affect schools. We know in the spring you guys have a lot of different events coming up. So that is in the final stages of being finalized, and I should be able to get that out to you in our follow-up email either this afternoon or tomorrow morning. So keep an eye out for that. So here is just a little update on Pima County data and where we are right now. We are currently in a high transmission. Countywide, we are seeing more than 2,000 new cases per day. And our 7-day rolling case count is over 11,000 cases in the last 7 days. So currently we're at 1,084 cases per 100,000 people here in Pima County. We also have 28% test positivity. That means for everyone testing, 28% of those are positive, which is extremely high. Unfortunately, these are the highest case counts that we've ever seen throughout all of COVID. However, we did have just 64 deaths over the last 7 days. And as you all are well aware, we have accelerated school transmission. Here's our epi curve. So a traditional epi curve looks more like November to February of last year, where it goes up and then it comes back down. Unfortunately, our curve went up in August and then never came back down and went up more in November. And now we're way up at over 2,400 cases per day. This is daily case counts. So this is where we are right now. So for vaccination rates, we've given approximately 1.65 million vaccines here in Pima County. Per the CDC, our county is 68% fully vaccinated for everyone over 5 years old. That number, sorry, if everybody could just stay on mute until the Q&A, that would be great. Thank you, guys. Our vaccination rate is, 68% fully vaccinated for those over 5 years old, although for people who are over 65, that's 92%. So our older population is more fully vaccinated than our younger population. Some census tracts and areas, of course, are lagging behind in vaccination uptake. And 37% of people who are fully vaccinated have also received a booster shot. So that is my data update. Before we get into Q&A, I wanted to talk about the pooled testing for a minute. We did receive an email this morning from, late last night actually, from the state regarding pooled testing. So generally with the pooled testing, we know that people, the Concentric comes in and tests, and then you guys follow up with rapid tests. Unfortunately, at this time, the state is also out of tests for this purpose. Per their email, which I will include in the in our follow-up email, I will attach this email from the state. But in this email, they are working to purchase additional antigen tests. So the BinaxNOW test that we've been using very widely and the state has been using are the ones that are experiencing an extreme shortage at the moment. So they're looking into other options for the antigen tests. So this may mean retraining some staff. However, Concentric will handle that. So we will attach this information so that those of you who are participating in pooled testing will have this information from the state. We'll get that out to you today. And then as far as other testing updates, I don't know if Erica is on quite yet.
Hi, Katya, I'm on.
Perfect. If you want to give us a little update on testing, then go ahead.
Sure. Hi, everybody. Thanks so much for all of your patience with me returning to the office. I much appreciate it after our holiday. I'm going through all my emails and voicemails, and I'll get back to every message that I have received, but we are experiencing a shortage, as Kat had said, in testing supplies. So our prioritization list still places schools first. So you will definitely still be our priority here, but we'll just need a little bit more of your patience as we're figuring out who's getting how many. We have also started using the Quidel QuickView antigen test instead of the Abbott BinaxNOW. You might still receive Abbott BinaxNOW tests, and I'm currently working with the state to work out the details on how your CLIA waiver might change. You won't need to repay. It would just add a line. Anybody who's filled out the CLIA, you're familiar with how you had to put the brand and the test and the type of test it was. It would just add another line. You wouldn't need to, that would not be a charge that you should have to pay. But we'll get you guys a video, since everybody who's already administered the test is already familiar with shell and nose swabs that are used by this test. You'll receive a training video and an informational blurb about what's going on with your CLIA waiver. But that is the testing update that I have for today.
Perfect. Thank you so much, Erica. And will you hang around for a little bit if there are questions? I'm hoping.
Yes, I will.
Okay, awesome. Thank you so much. All right, perfect. So we can get into some Q&A. I know that there have already been some questions in the chat that my team is working to answer. Whatever doesn't get answered in the chat, we will do our best to answer that in the follow-up email. But if anybody has some questions, you can go ahead and unmute yourself at this time.
Hi, can you hear me?
Yes.
Hi, so I just put it in the chat, but is Pima County going to open more testing sites?
Yes, so we are actually working on that right now. So I don't know how many details I can share, but yes, we are working on opening more community testing sites.
Okay.
And we should have information about that in the next day or so, I believe.
Wonderful, thank you.
Yep.
Can you send out information on the sensitivity and specificity of the new rapid test we'll be using?
Yes, when I send out the information, I'll attach the FDA emergency use authorization form that goes into all the details about specificity and predictive values and sensitivity and things like that.
Perfect. Thank you, Erica. All right.
Kat, this is Matt. I just wanted to draw your attention to a couple of questions in the chat.
Perfect.
First was if the county has a school outbreak, like total number of outbreaks and total positive case count.
Yeah, so let me just go to our webpage. That is on our our Pima County webpage. So let me pull that up really quickly. This data does get updated weekly. So here we go. Sorry about that. So here is the school case information. So total cases are at 8353. Outbreaks are at 239. I will say that one of the difficulties we're currently having is because school staff continue to be very overwhelmed. We aren't getting the same number of reports as we were before. So outbreak reporting and things like that has gotten a little bit more spotty, which is understandable. So we are losing some insight into exactly what is happening in the schools. But this is, with the data that we have, these are the current numbers that we're aware of. And this gets updated. This was updated on yesterday. And this is usually updated once a week. So we should see another update soon. But if you ever want to check it out for yourself.
This is Kathy Steinley. I'm sorry, can I interrupt for a second?
Yeah, go ahead.
Two things. Number one, while it's very helpful to have the case counts that you give us, I think what might be more meaningful would be if we know like what the increase has been over the past week, not like the aggregate. Number two, the other thing that I'm running into is that we have so many cases that are positive, and while we're doing the contact tracing and trying to get it in, trying to see who's epidemiologically linked, because they frequently have siblings and parents that are positive at home. I've got classrooms where the kids that are turning positive are not close contacts of the other ones in the classroom. And it's making it really hard to determine an outbreak because I may not have two clearly epidemiologically linked cases, but I may have 5 in a class. At what point, I mean, do we need to look at what an outbreak, like if we have a certain percentage of a classroom out, that's an outbreak as opposed to 2 epidemiologically linked cases?
Yeah, absolutely. And we are taking into consideration numbers like how many kids are currently out with COVID, like illness and things like that. So one of the things we're working on is generally when there are 2 or 3 cases, people call us to report a potential outbreak, and we ask a lot of questions over the phone to try and get all the information for EPI to make a determination. And we are currently trying to move to kind of a survey version of that to streamline everything, and EPI will be able to pull information and review it more quickly to make a determination and follow up with the school. So that's something that will hopefully be coming in the next week or so. And then, yes, but that is something that we take into consideration, is how many other students are out with illness or COVID-like illness. It's not necessarily only the epidemiological linking between the two cases.
Yeah, 'cause we have huge numbers and huge numbers quarantined. I've got one grade that I'm fairly sure there's tumbleweeds in the hallway because there are no kids.
Yes, yes.
But the other question would be, is the letter on the website the most recent outbreak letter?
Yes, so this sanitary measure has been updated, and then if you go to the schools and early education info here,
Right.
This was updated yesterday. So this is in English and Spanish for parents and for staff. So this
Okay,
is
good, because the one I sent out earlier, to be honest, it was sort of a Captain Obvious letter, because it said, there's COVID in the schools and it's contagious. And I think everybody knows that.
right.
So,
Yes, and this still does have, pretty basic information about COVID in general, which I think we all know now, that you need to wash your hands and things like that. It is still in this letter, but they have been updated in the last day or so.
okay, thank you.
They're just posted. Yep. So and I don't have any exact numbers in this moment to share. I can try and get this from EPI for the follow-up email. But I believe that we're anticipating that in the first 2 weeks of school, we have seen more cases in schools than all of last semester. I don't have that number confirmed, but I will get you the numbers as quickly as I can for the follow-up email. So thank you, Kathy.
Hey, Kat, this is Matt. This is Matt Christenberry. I can't comment on the exact numbers, but just from an EPI perspective, I can definitely say we're definitely seeing a lot more cases and close contacts and outbreak evaluations coming in, especially over the last 3 days. That's been significantly higher. I think everyone on this call is very aware of that because you all are the ones that are seeing it and reporting it to us. So we're definitely seeing a significant increase. So we appreciate all the efforts you guys are taking to follow up with these cases and contacts and work with us on these evaluations.
Yes, thank you, Matt, for hopping in. All right.
This is Cheryl.
Yep, go ahead.
This is Cheryl at Southside Community School. I have a couple questions. One would be an ask, I guess. It would be very helpful for us, for me, to have, this is echoing, I believe it was Kathy, a percentage of the classroom. I'm working on all levels, tracer, tester, as we're pre-K through 8, and we have a couple classrooms that we have what I think would probably be percentagely appropriate, but they aren't same families, and we just came off of a break and la-di-la-di-la. So that would be something that would be helpful if we do need to look at isolating a classroom or having them go to Zoom. That would be helpful for me, because it's very challenging for me with the different hats to do contract tracing on top of everything else. So that's an ask. If we could get a percentage of students out of a classroom of when we need to isolate that classroom to distance learning, that would be helpful. Second is, I don't know who I need to speak to, but I want to verify that I'm reporting correctly. I've been having some struggles with concentric pool testing and being able to change who's on our list. And now I know that we stopped pool testing last week because of the rapid test issues. However, since we're not doing that, if I could get somebody to call to make sure we're reporting accordingly through either Arizona Department of Health Services or who I contact on that would be helpful.
Yeah, sure. Are you trying to report from the pool testing or just?
Both.
Okay.
We scan in on when we were doing pool testing. We paused it this week because we didn't have enough rapid tests. If we hit positive, we're doing both the swabbing and the secondary testing on our own. We haven't had Concentric's help. So So we scan in the tests we can, but it's been extremely challenging to edit our database, and we can't figure out how. And so those people that I am not putting in Concentric, I put in the Arizona Department of Health Services page, but I'm concerned that I may not be reporting as you guys would like to get accurate numbers from us. So I just wondered if there's a person I could talk to about making sure I'm doing it correctly.
Yeah, send us a email to schoolsupport@pima.gov, and we'll follow up with you on the specifics of your reporting. Yeah.
I appreciate that.
Yep.
And hi, Cheryl, this is Matt Kristen Berry. So I can kind of talk about your question, and I would just say first, I know a lot of schools and stuff are very busy, and it's sometimes easier just to kind of make a decision on your own, and I completely understand that. If you have a classroom or an activity that you think may need to be closed or you want further evaluation, you can send an email to that same email Kat just mentioned, and we can follow up with you. And the EPI team can follow up with you. And as far as percentages go, I'll follow up with our leadership team to see what we can potentially put out. I always hesitate about using just a percentage of the class infected because we have an assessment that we go through and we ask a lot of questions for a reason, because we know it's not only the cases in the classroom that impact that. But what I would say is we've been working on changing our guidelines a little bit. For example, if a school if a classroom is consistently and correctly wearing a mask, then we're okay kind of pushing the limits a little bit before we would close the classroom down. And then also, what's the COVID-like illness in that classroom, and then what's the call-outs in that classroom. Those are the kind of things that we would look at. But really, if you're not masking, say your classroom's not masking, around 15% of the classroom being infected would be the time we would recommend that classroom being sent home to do quarantine period. But say if you do have a classroom that's masking consistently and correctly, we would be okay with 20%. But again, that's kind of with a grain of salt, because there's other factors that may influence us to recommend you to close the classroom before or even after that fact. So those are the kind of things we would look at, but I will follow up with our leadership to see what we can get and put out to you all in that regard.
Yeah, and I just want to reiterate on classroom and school closures. This is something that our epidemiology team always works with schools on. If that's a recommendation that we're going to make, we would work with the principal or the superintendents on making decisions like that. However, the school has the school administration can also make those decisions for their school, so it doesn't always have to come from a recommendation from us. So if a school feels that they have reached the point that they need everyone to do virtual learning, or that they want to close a classroom, or whatever that may be, the school can also, the administrator can also make those decisions without us. So we're happy to consult, absolutely, and provide our feedback with the administrators. But if you're feeling like there's an emergent situation and want to make a decision, you do not have to wait on us. So I just want to throw that out there. So perfect. We do have that. Yes, you're so welcome.
Yeah, I appreciate that. It's helpful for us too, as we're trying to, also mitigate our teachers and staff's stress of trying to do multiple platforms of learning. So
absolutely.
Their health is high on my mind too. So I appreciate the help.
No problem.
Kat, my name's Heather. I just have a question to ask you, and it might be a loaded question, but when are we going to stop this? If we're at 68% vaccinated, at what point do we start treating this as a cold and say, if you're sick, don't come to school? Is there any light at the end of this tunnel?
So I would say that that we will not be stopping isolation and quarantine recommendations anytime soon. And as long as this continues to be extremely transmissible, and people are still having severe illness and death, I think that we will always encourage isolation and quarantine. As far as other guidance, that changes based on the need of the community, really, and also based on federal guidance. But I don't see isolation and quarantine going away anytime soon. So that's just my opinion. That's not, that's not a CDC approved message, but that is my impression of what's going on.
Okay.
Yeah, and hi, this is Matt. I agree with Kat. I think, yeah, we're continuing to assess cases and contacts, but also looking at the hospitalization rates and the death rates like Kat had mentioned. And unfortunately, we're still in a very dire situation with our hospitalizations. They are stable, but they're stable at a very high level. So we continue to monitor that. And yeah, I hope at some point we're able to kind of be at a point where this isn't as severe, it's not as many cases and much contact tracing, and there won't be as much elevation to it. But yeah, like Kat said, I don't think that's going to be anytime in the near future.
Hi, everyone. This is Dr. Gerald from University of Arizona, and I'm in pulmonary medicine, and I will just echo what the health department has said. One of our main reasons right now is that our hospitals are completely overwhelmed and inundated. And so while many people are talking about how Omicron is not as severe in terms of mortality and morbidity as other variants have been, our hospitals are still completely overwhelmed. And so we still need to contain this virus so that we can, keep them under control.
Absolutely. Thank you. All right, we do just have a couple minutes left. So if there are any other questions, I don't know, Matt, if there's any questions in the chat that you want to read or.
Perhaps, Kat, you can comment on the county's stance or guidance in terms of when it comes time to shut down a school or revert back to virtual learning.
Yeah, so again, this is largely a decision. The virtual learning is a decision to be made by school administration. So if you have concerns about, safety within your school or how the school should operate, I'd encourage you to talk to principals and superintendents about those things. However, as far as a whole school closing, as Matt said, there are many other Matts. Sorry, there's two Matts, which gets a little confusing. But as our EPI team has said, there are many different factors that go into making decisions like that, and those decisions will always be made in conjunction with school administration. So we are not going to come in and just order a school to close. That will be a joint decision, but there are many factors that go into that, including positivity rates, but also COVID-like illness, absences, masking, all of those things. So, all right, let's do one more question. I believe somebody has their hand raised. Randy, you can go ahead and unmute.
Yes, we just started the Test Mass Stay program, and I'm finding that the reporting on the COVID testing site is very difficult to use when you have multiple students. And I'm wondering if there's something that can be done to make it so that we can test or put in more than one student at a time.
For Test Mass Day, which reporting are you?
I'm talking about the testing reporting site, which we've been using the Abbott test, but it has a pull down menu with choices of different tests and which school district you're in, and it only allows for one student per entry. And I'm wondering if there's something that could be done. So it's cumbersome to use, and it would be a lot easier if there was some other kind of spreadsheet where you could load more than one student per entry. Does that make sense?
I believe so. I think that maybe what you are referring to is actually an ADHS reporting form online.
Okay, yeah.
Yeah, so we don't have the ability to change that because that's a state form, but we do have, there is a web application called Simple Report that you are welcome to use. It's free, and it allows you to enter all of your student and staff information and then report it all at once. And then it stores that information on a secure server, so that the next time you do testing, everybody's already in the app and you could just kind of search their name and pull them up. And then once you get your test result and hit submit, then it reports it to both the county and to the state. So that's also an option. So I will put some information. You can go to Simple Report, or I think it's simplereport.gov. I'm not sure. This is a app that was created through the United States Digital Service in conjunction with the CDC. So anyway, you can look that up, but I'll try and remember to put a link to Simple Report in the follow-up email that will have some more information for you. But you can sign up for that as well, and that will help you avoid that ADHS Google form where you have to enter all the information. Yeah.
Thank you.
Yeah. So I'm going to wrap up the call there. We're just a couple minutes over, but I appreciate everybody hanging around. And if you have any questions that did not get answered in the chat, we'll try and follow up with those in our email, as well as sending you these resources. At this time, just keep in mind the outbreak letters on our website, as well as the close contact letters. Those have all been updated on our website, and we have sent those out by email as well. So if you need the most up-to-date ones, let us know. So thank you so much for all of your help and support, and just continuing to work so hard to support the students in our community. We appreciate you all. And we'll speak to you next week. Thank you.
The Simple Report link has been shared in the chat. Thanks for doing that. So.
Oh, perfect. Thank you, Stu.